If you look at ways to help improve value in the healthcare system, quality is the foundation that we really want to invest in order to take our already high-value care to the next level, which is, it's harder in Vermont. We're starting at an amazing starting point.
OneCare, as an accountable care organization, is focused on value, which means it is both accountable for the quality of care along with the cost of care to incentivize healthcare providers to implement quality improvement measures that are proven to improve healthcare and well-being. OneCare ties payments directly to quality measure performance.
We want to move from having the incentive be to see people more often and do more procedures, which is how you make more money in the fee-for-service world, to taking good care of a population of patients. We used to have like 30 quality metrics that we used to try to monitor and intervene on. But the truth is, when we're in the quality mindset, and even if we're only working on 2, it elevates the standard of your care across the board. We start thinking about choosing wisely. We start thinking about how to meet patient expectations and develop a treatment plan that will work for them.
At OneCare Vermont, we are building the infrastructure to support and monitor quality improvement efforts across the state. Over the past several years, we have worked to align quality measures and incentives across the payers that we contract with on behalf of our participating providers, and have selected 4 of those 18 measures to provide clearer focus on priorities and to give additional financial incentive to high-performing providers. While the measures will change over time with need and performance, the current measures tied to this incentive fund include 2 for adults, focused on management of diabetes and hypertension, and 2 for the pediatric population, developmental screenings for young children and depression screenings for adolescents.
An easy example of continuous quality improvement would be diabetes. It is a very common condition in the entire country, but certainly in the state of Vermont. Decreasing cost is not about limiting care, it's about trying to prevent complications from happening. So that's why we want to do continuous quality improvement in diabetes, because it's a condition that can have multiple complications that can be serious. If you can have a complication in your eyes, you need to have an eye exam once a year. If you can't feel your toes, you're at risk for amputations. We do foot exams and check for sensation. So any of those could be a quality intervention where you're deciding, let's really focus. You don't have to actually be doing a quality intervention on every single disease in medicine in order to actually do better on all of them, because we're in a quality science mindset when we practice. And it's really now just an expected part of primary care. Like, it is what we eat, breathe, and do. This is how we practice. It's the foundation of value-based care.